Hello and welcome to the video. In this video today, I'm going to tell you some important and interesting facts about the N95 respirators. We will also get to know the main differences between the normal surgical masks we come across regularly and the N95 masks. A respirator is a personal protective equipment or a personal protective device which can be worn by a person on the face or head to cover at least the nose and the mouth. The main purpose of wearing N95 respirators is to prevent the inhalation of hazardous airborne particles and infectious agents, gases, vapors, etc. The N95 respirator is believed to be very effective in removing particles from the air that we breathe in. They can prevent almost everything from small particle aerosols to large droplets. Now, let's have a look at the main differences between the normal surgical masks and the N95 respirators. The most striking difference between the two is that the normal surgical masks are loose-fitting masks, whereas the N95 respirators are the tight-fitting ones. Another important difference between the two is that the normal surgical masks can only block large particle droplets, splashes, sprays, or splatter that may contain germs. They cannot block very small particles and microorganisms in the air, whereas a N95 respirator is very effective in blocking at least 95% of the airborne particles, including large and small particles and microorganisms. Surgical masks are the disposable masks which are not intended to be used for more than once, unlike the N95 respirators that can be used multiple times depending on the circumstances. Now, let's have a look at some of the important things to remember when using the N95 respirator. N95 respirator precautions. If a person is suffering from chronic respiratory, cardiac, or other medical conditions where there is a difficulty in breathing, such a person shouldn't use N95 respirators. The N95 respirators are mainly meant for the use in the construction and industrial type jobs where there is a high risk of inhalation of both large and small particles. Before using a respirator or getting fit tested, workers must have a medical evaluation to make sure that they're able to wear a respirator safely. The CDC, or the Center for Disease Control, does not recommend the routine use of respirators outside of workplace settings. According to the CDC, everyday preventive actions to prevent the spread of respiratory viruses, such as avoiding people who are sick, avoiding touching your face or nose frequently, and covering your cough or sneeze with a tissue are more than sufficient to prevent a viral infection from spreading. When using the N95 respirator, achieving adequate seal is very important. It should be worn properly and there should be very minimal leakage around the edges. How to tell whether the N95 mask you're using is approved or not? This can be done by looking for the NIOSH approval number and the label. NIOSH air filtration rating is the classification of filtration in the United States given by the National Institute for Occupational Safety and Health, that is NIOSH, during the certification and approval process for the respiratory protective devices. If the N95 respirator you are using is NIOSH approved, it will have the NIOSH name, the approval number, filtration designation, lot number and model number printed on the respirator. If not, the one you're using may be a fake. That is it for today. These were some of the important things you need to know about the N95 respirators. We will see you in the next video. Bye for now.